Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about what healthcare leaders can learn from the federal election. Actually, I'm not talking about what's happening in Washington right now. HFMA is addressing that the way we always do, in an apolitical way. We have outlined the potential impacts of the election on healthcare organizations, and we're planning a webinar in January to address that in depth. What I'm talking about today are lessons learned from the election that have nothing to do with legislative battles or political agendas. It's about something much simpler: listening. Think back to November 8th. It's been a while, but I'm sure the experience of watching election returns is still fresh in your mind. Some people were thrilled, while others devastated by the outcome. But the common thread was the surprise, even shock, which people felt as it became clear that now President-elect Trump was going to win. Practically no one was expecting it. One pundit tweeted that he had never been so wrong about anything in his life. The question everyone asked themselves was, how could the polls have been so wrong? The answer, as we realized on November 9th, is that the elite, politicians, pundits, the media, think tanks, and academics, among others, are totally out of touch with at least half of the population. Probably more than half, because voter turnout was so low. The elite in this country just aren't listening. And that is on both sides of the aisle if you go back to the entire election process. Healthcare leaders are, in a sense, the healthcare elite. What I'm wondering is, are we also out of touch? Do we have ways of putting people, patients, plan members, consumers, front and center when we're designing and improving our financial and operational processes? Think about the ways that people access and navigate healthcare. Think about the financial aspects of the healthcare experience. Do we have processes that bring the voice of the customer into play? If we're honest with ourselves, we would acknowledge that many of our operational processes are designed around us. They're suited to our business-to-business practices, to our internal policies, and to the relationships between health systems, health plans, and clinicians. The way we operate is not built around what people who use healthcare want or need. It sure does. We're asking ourselves tough questions, such as, have we structured and organized our resources, and our entire enterprise for that matter, with our customers in mind? I'm referring to our website, our digital tools, webinars, our magazine, our conferences, even our chapters. The list goes on. And the answer we came to is that we have room for improvement. Don't get me wrong, we do great things, and we have great content. And we do help members navigate through our complex industry. But as we've looked honestly, we've concluded that our content is designed more toward the content generators than the content consumers. The good news is we're changing. We're developing cross-functional teams, including a voice of the customer team, to hardwire your input into everything that we do that touches you. It's our way of avoiding the same mistake that just played out at a national level in the election, when the voices of so many were missed. If you are in a position to shape operational processes that affect customers, you have an opportunity to avoid making the same mistake too. You have an opportunity to listen to your customers and shape everything you do around them. Ask yourself the tough questions. Why isn't it easy for customers to get out-of-pocket estimates? Why aren't explanations of benefits forms easy to understand? Why are there so few health plan designs that focus on services that keep people healthy? Why are services not coordinated to create a seamless, understandable experience for consumers? If we don't start listening to customers, they will vote with their feet and with their pocketbooks, turning to innovators or disruptors that are listening and that are nimble enough to respond to what they hear. It's a tall order, but that's what leadership is. And I'm confident that we are up to the challenge. Thanks for watching. On behalf of all of us at HFMA, I wish you joyous holidays and a happy and healthy new year. I'll see you in 2017.